most of the babies, or rather all the babies, have the straining tendency. That is basically to help the peristaltic movements, and that happens to each and every baby in the world. So, that happens spontaneously even at sleep and things like that. And you don't have to get too concerned, and you don't have to lose their sleep of that. And treating that is a futile attempt. Just leave it alone. Treating a disease is okay. Treating a normal phenomenon won't give you any result. The same with gas. As long as the baby is on milk-based feeds, the baby will have gas. And when the baby swallows milk, if the baby swallows a lot of air with that, the baby keeps on burping in between, which is normal. And when the gas is passed as flatulence, that also causes a lot of foul smell, which especially during milk-based feeds. And it's worse when babies on animal milk or formula milk. So that is a normal thing. So something which you can prevent is to decrease the colic and things like that is, one, go for exclusive breastfeeding. After feeds, put the baby on your shoulder, pat properly. Sometimes you may hear a loud burp, or sometimes multiple small burps, or sometimes you may not hear a sound at all. But still, putting the baby on your shoulder and patting is very important. Continue that for 5 to 10 minutes. Or you can put the baby on your thigh and do the same thing. You can give a little bit of tummy time to the babies. Putting the baby supine and giving a little bit of cyclic motion of the legs also helps up to a certain extent. Maternal diet hugely influences the colic pattern of babies. Certain Ayurvedic medications, certain food like prawns, crab, jackfruit, all these things are usual culprits which cause a problem. If you find such a problem, then you have to avoid them. Otherwise, I'm not in a position to comment on whether you can take it or not. Then something which is usually concerning is slight bleeding from the umbilical part once it falls off. That may happen for 2 to 3 days, but cleaning that area properly, mopping that area dry, and keeping it clean is the treatment for that, and it heals without much issue. Sometimes babies may have a tooth at the time of birth itself. It's called natal tooth. If it is very loose, you may have to remove it. Crying before and after passing urine is normal. They don't know to strain to let their urine or stools out. So they may yell when they get that feeling. And once it is out, because of the soiled cloth and wet cloth, they again cry. So crying before and after urine and stool is normal, but while passing urine, if they cry, it's abnormal. Loose stools. The motion goes through a lot of changes during the course. Initially, it is black stools, it's called meconium, and then they start having loose stools, which happens for 2 to 3 weeks. And then they start passing paste-like stools, and that goes on for some more time. So once it is semi-solid, baby may not pass a stool every day. There may be a gap of 3 to 4 days, sometimes up to a week. As long as the baby is feeding properly, no vomiting, no abdominal distension, you don't have to treat it. Just leave the baby alone. Yellow stools is normal. Green stool are as normal as yellow stools. You don't have to treat it. Sometimes once the baby is started on complementary feeds, you may see undigested food of what you have given, beetroot, carrot, different multicolored stools being passed. All these things are normal. Yellow urine is normal, especially when the baby is on multivitamin drops. Pinkish crystals seen in the nappy, especially in boys, it's called urate crystals, is normal, most commonly seen in summer season. Pseudo menstruation seen in girl babies. As I told earlier, the maternal hormones which passes through the placenta and reaches the baby may cause slight development of breast and uterus. And once the hormone supply is cut when the baby is out, it may cause menstruation as in adults. And that happens, the bleeding may happen for 1 to 2 days, which is normal. Whitish discharge also may occur in female babies due to the same reason. You don't have to treat it. Abnormal things in gastrointestinal system. One is tongue tie. The baby's movement of the tongue is restricted. Some babies have it very severe that it affects their feeding. In that case, you may have to get it corrected immediately, but otherwise after 6 months before they start talking, you may have to get it corrected. Dental caries is abnormal. You have to take a dental opinion. Persistent vomiting and bilious vomiting, yellowish discoloration in vomiting is abnormal. Abdominal distension along with constipation and vomiting is abnormal. So you have to get it checked. Colic, as I told earlier, you may be able to correct it up to a certain extent. If not, you may have to take a medical opinion. Umbilical granuloma, umbilical falling off, a little bit of blood stain is normal, but if there is continuous foul smelling discharge from there, it's probably because of a granuloma and it requires treatment. The umbilicus protruding out, It's called umbilical hernia. It's not because of water entering the umbilicus. It's a hernia and it disappears by 9 months to 1 year of age. You don't have to treat it. It's a self-limiting thing. But inguinal hernia, a hernia in the lower groin region, is abnormal. A swelling which appears when the baby cry. When you try to press it inside, it goes inside. It's probably a inguinal hernia. As long as it is not obstructed, it doesn't cause much of a problem, but it is mandatory that it is shown to a surgeon and may need to be corrected. White stools is abnormal. Green, yellow stools are normal. White stools are probably because of a problem in the bile system of the baby and the bile is not reaching the stools. In that case, it requires a surgical opinion and it's kind of an emergency and you need to get treated. Crying while passing urine is abnormal. Before and after is normal. Poor urine stream, especially in boy babies. Usually in boy babies, you get a stream which is quite long enough to wet the caretaker. If the urine is continuously dribbling onto the baby's leg, then it's abnormal. You have to get it checked. There is something called as posterior urethral valve and that has to be ruled out. If the baby is not passing at least 6 to 8 times urine per day after the first week of life, then it probably means that the baby is not getting adequate milk. You have to get it confirmed.